happen to know what the fastest growing occupation in the U.S. is? According to the Bureau of Labor Statistics, it is nursing. Nursing contributes to the well-being of every one of us, and they make up the majority of the healthcare industry. The purpose of my speech is to inform you about the profession of nursing. Today I will talk about the job description for nursing, what it takes to become a nurse, and where this position can be found. First, I would like to give you the job description for nursing. According to Charter College's nursing school, registered nurses provide and coordinate patient care, educate patients and the public about various health conditions, and provide advice and emotional support to patients and their family. Typical registered nurse duties are to monitor, record, and report symptoms or changes in patients' conditions. Also, they modify patient treatment plans as indicated by patients' responses and conditions. Another duty is that they have to instruct individuals, families, or other groups on topics such as health education, disease prevention, or childbirth, and develop health improvement programs. In the job of nursing, nurses have to deal with a difficult work schedule in a high-risk environment. As all healthcare workers, nurses face a wide range of hazards on the job. First, nurses spend a considerable time walking, and standing. Most nurses can expect to work 12 or more hours a day. A big factor is that they also need to be able to cope well with stress, since nursing involves direct involvement with human suffering, emergencies, and other pressures. According to ncbi.gov, nursing personnel most frequently experience blood and body fluid exposure, as well as musculoskeletal injuries related to ergonomic hazards from lifting and repetitive tasks. Now that you have learned about different aspects of the nursing role, I am going to discuss what it takes to become a nurse. I will start with education. Just as with most careers, the first thing is to graduate high school or to get a GED. Then you can choose a nursing school, apply, and choose what path you will take, whether it is a Associate of Science in Nursing, Bachelor's of Science in Nursing, Master's of Science in Nursing, or a diploma, or to the military. The entry-level education for a registered nurse is an associate degree. With a Bachelor of Science in Nursing, it prepares you for the bedside and leadership roles. The Master of Science in Nursing takes 2 years after you earn your BSN. It qualifies you to work as a nurse educator or manager and is a prerequisite to get your PhD. Earning your nursing diploma takes 2 years to a participating hospital. If you enter through the military, you can train for 2, 3, or 4 years in an ROTC nursing program at a college or university. It will help you to apply for financial aid and scholarships. Once you are finished with schooling, the last and most important thing to do is to take the National Council Licensure examination for registered nurses. For nursing, English, math, and science are required. And you will also be required to take anatomy, physiology, microbiology, chemistry, nutrition, psychology, and other social and behavioral sciences, as well as in liberal arts, to start a nursing program. Once you become a nurse, there are skills that are needed, such as being a critical thinker, having interpersonal abilities, communication, having good mobility, being tactile, having good motor skills, and having good hearing and visual skills. You have gained insight into what it takes to be a nurse. So the next point is where this position can be found. Registered nurses work in all health care settings. Some places where they can work are hospitals, nursing homes, medical offices, ambulatory care centers, community health centers, schools, and retail clinics. And this slide shows the different places where nurses are working at, such as the government offices or such as that. Registered nurses earn on average $64,690 a year, although compensation depends on level of education, experience, geographic location, and the type of facility, which is shown here in this next slide. As was previously stated, I have informed you on the description for the job of nursing. what it takes to become a nurse, and where this position can be found. Although nursing is the fastest growing occupation, by 2020 the U.S. will face a shortage of 800,000 nurses. Few people realize the importance of the profession of nursing. After researching this topic, nursing has become my occupation of choice for the future.